It's just
And $1
sad.
million is what they say it takes to retire in Canada. And I mean, you could say, well, whatever, they got $1 million, but I mean, being a doctor is not easy. I'm glad we have some doctors. I don't always agree with everything they say, but I don't know. Maybe I don't care.
No,
Maybe
no, dude, it's the
not
worst.
care, but we probably need doctors, right?
It's
Or
the
do
worst.
we?
It's the worst profession for this to happen to right now, too. Like out of all the professions, the healthcare industry is the one that's pushing back from this. It's kind of strange, right? People don't think of Canadian doctors with our socialized medicine like having to have their own corporations. But I mean, I know I used to have a doctor. She was a smart Eastern European lady with like I think she was like a doctor, a family doctor, and some 2 or 3 other specialized. She opened up her own clinic because I guess that's what that's what they do when they like incorporate. They open up their own sort of practice, and she was all depressed. She couldn't. I think it was very hard for her to make it by, even with all the expenses and all that, and all the like. It's not as easy. So I can see this being a real difficulty for Canadian doctors. I was kind of
Yeah.
shocked. I was like, why? Like you've got your own practice that apparently,
You'd think doctors are doing better than they are, but welcome to Canada. Welcome to Canada. Okay, let's start with this. Let's go back let's jump in the time machine and go back to 2017. I had to learn how to do a special Google search to find this. I did, I think it was before colon
2023, before 2023.
Yeah, and there's a date for it. I think it was before. I didn't use 2023, but that's where I got it from. So I think I seen a meme, and then I Googled how to do it, and then I found it, and then I was able to find this because everything else I searched I mean, the news cycle moves so fast; it's nearly impossible to find anything relevant about.
Well, that's what I was trying to explain to you before about Google, how it's broken, how the internet seems broken. And you were like, oh, no, it's fine. And that's what I meant.
But it's fine. You just have to adapt to use it better, like I did. I'll teach you the ways.
Adapt to pre-2024 Google searches.
Well, it depends what you're searching for, right? Something else you might want to do pre-Donald Trump, pre-2016, or pre-Obama, or whatever. Yeah. Hey, our resident gay sister just had a baby boy. Congratulations, Andre. I don't think that's your real name. I do know your real name. That's okay. Okay, let's jump into this. So this is from 2017. I just want to break this down and kind of it kind of gives some background on the situation. Then we'll play a couple of clips and we'll move on from there. Okay, the federal government has proposed to change Canada's tax rules so that a small business owner will no longer be able to avoid paying taxes on will no longer be able to avoid paying personal income tax on passive investment income. That is income that is sheltered inside her business or his. I mean, 2017, it was already starting. At least it doesn't say there. I guess there would almost be relevant in this case. You know what I mean? They could have put there. There's no there. Inside her business. As it stands, self-employed Canadians who bill their customers through a corporation are entitled to pay the small business tax rate on the corporation's income, keep some or all of their earnings in the corporation, make investments that have no connection to the business through the corporation, keep any resulting investment income inside the corporation, and disperse that money to themselves in the form of dividends. The effect is to defer taxation and to avoid the top personal tax rate on high incomes. The Liberals call this an unfair tax loophole. By all accounts, they plan to close it. The government says it is necessary to do this to achieve fairness. It is unfair, it is argued, that the richest Canadians have access to tax avoidance technique that is out of the reach of most taxpayers. Politically, this reason is compelling as a question of pure tax policy. It seems difficult to dispute, but as a practical matter, the fairness argument is tougher to sustain in one particular set of circumstances, where the owner of the small business is a doctor. So this is already in 2017. 7 years ago, a couple years into Trudeau. Doctors work in the public healthcare system. They bill a provincial or to territorial government for the services they provide. The market does not decide how much they make per patient examined or per procedure performed. Our governments do this, and they are contractors, not employees. Thus, they are in a position to incorporate as small businesses. Our healthcare system functions on the assumption that they will operate this way. A self-employed doctor's take-home pay depends on 3 variables. The first and most significant is how much the provincial or territorial government agrees to pay her for each service she bills. I mean, there's a lot of gendered language in here. They could have just went back and forth even, you know? The second is how many services she actually provides, a function of how busy she keeps her practice. And the third is how her earnings are taxed. Governments, federal and provincial or territorial, control the first and third of these 3 factors. Unlike other small business owners who ultimately can decide how much to charge their customers or clients, self-employed doctors are entitled to demand only what we citizens, through our elected representatives, agree to pay them.
Can I ask a question here? Just chime in.
I might not be able to answer it.
Well, no, but I think that's why, the main complaint I hear now is that you can only go to a doctor for one thing. So let's say you have 3, you've got chronic illness, you've got 3 massive things wrong with you, right? You have to drive to the city to go for one thing only because they bill per visit. So you can't just you can't just be efficient and do all 3 things in one visit. So this is why, because they need to maximize their billing, I think, right? So you go in for a quick, 5-minute thing, and they just hi, bye, this and that. It's a 5-minute appointment. And they probably bill for a regular 45-minute standard thing or an hour or something, and then they have
we should
the rest of the day to fill that up.
On what? How it all, we should do a show on how it actually all breaks down, on how the doctors how the whole healthcare thing, the money flows.
Yeah.
I wonder if we could find the info.
And the problem is there's no incentive to be efficient or effective, right? And no wonder why there's a wait. So, no wonder why it takes months and months to get in, because everybody's going in for one tiny thing for a 5-minute appointment that takes 45 minutes instead of going in to see them about everything that's wrong with you.
Is that how they do it in the States? Let us know. That is how it has been since Tommy Douglas first brought Medicare to Saskatchewan.
Oh, you have to use my new province as an example.
Well, I didn't write this paper, but are you already claiming the province? I feel like you have to live there.
Don't call it a paper. You might get in trouble.
I feel like you have to live there for a little longer before you can say my province.
Or maybe call it an article or something.
A paper? Isn't it a paper?
I don't think so.
Policy options. It's an economic policy. It's probably just an article.
I only say that because I heard a biohacker who was getting in trouble because he was calling things studies when they weren't,
Well, we're not telling people to put things into their anus and, crazy shit like that. Have you done any coffee enemas lately?
No.
No? You got off that train?
I'm off it, yeah.
You should do one before the show and see if there's we can see if we can notice an effect.
Super focused. Yeah.
Okay, that is how it has been since Tommy Douglas first brought Medicare to Saskatchewan. Self-employed doctors in Canada do not work for our governments, but our governments decide what they are paid. If an individual physician wants to earn more, she has to work more. An incentive structure that serves the rest of us just fine. I suspect that patients on waiting lists would not welcome a shift toward paying clinicians based on a 9-to-5 workday, rather than on the number of patients they see. Nor do we seem to mind that doctors have to complete many years of expensive education and specialized training before we let them practice on their own. And provincial and territorial governments seem quite content not to increase their healthcare budgets to provide doctors with the same paid vacation time, sick days, and pensions that public servants like nurses and police officers receive. That's kind of messed up.
Yeah.
Isn't it?
Yeah, it seems
almost like a game to keep them in the game as long as you can.
Yeah.
This is where the small business tax rules come in, because the federal tax code allows self-employed doctors to avoid the top personal income tax rate when they save for retirement or time off. Provincial and territorial governments can avoid either providing those same doctors with the benefits that civil servants receive or paying doctors higher fees in lieu of the same. In recent rounds of negotiations, provincial governments have expressly encouraged doctors to incorporate at the federal government's expense, rather than demand a larger share of provincial budgets. Doctors have taken that deal, which helps to explain why 2/3 of them are now reportedly self-incorporated. Providing these doctors with a tax-sheltered savings vehicle purposefully offsets some of the disadvantages that we, as a country, impose on them so that we can enjoy public health care. The tax rules we impose on the self-employed doctors are part and parcel of the same federal, provincial, territorial policy mix. Systems, the way they have for a century. Mixed systems? Why is there people?
Yeah, it cuts off like a line when you save it sometimes.
Those bastards. Okay, let's just skip ahead. Are not itching to raise doctors' fees or provide them with civil service style pensions and benefits. Removing self-employed doctors' ability to defer tax on passive investments, income held in a corporation, effectively means paying them less. A tax increase that is defended in the same name of fairness would, for this particular category of small business owners, be unfair. That is, unless doctors are presently overcompensated, an argument that the government and its supporters have so far declined to make. Ultimately, however, the difficulty of the government's fairness rationale is exceeded by the difficulty of doctors' bargaining position. Good luck convincing most Canadians to feel sorry for affluent professionals. The Liberals can camouflage a shift towards reduced compensation for doctors as a shift towards greater fairness or communism, knowing full well that any doctors who dare to stand in their way risk inviting public resentment at how well they are paid. So, I got that so far. We could jump over to... So, okay, now maybe before we jump over to that, I think I have here so yeah, let's do this first. Oh, look at that. It's already there. So this is from I believe the president of the CMA, which is the Canadian Medical Association. Proposed tax changes will hurt physician recruitment and retention. The Canadian Medical Association is concerned that capital gains tax changes introduced in the 2024 federal budget will have adverse effects on physician recruitment and retention across the country. While we support the healthcare investments announced by the federal government last week, proposed changes to the capital gains inclusion rates will have significant negative implications for physicians, as most operate their practices as small businesses. These changes could jeopardize ongoing efforts across Canada to recruit and retain a high-quality health workforce. Many community-based physicians have incorporated their practices as a means of efficiently delivering health services to Canadians. They also rely on their professional corporations as a means of saving for retirement, since most do not have access to employer retirement plans. Increasing the capital gains inclusion for corporations will create another barrier to retaining and recruiting physicians in a time when our healthcare system and the providers within it are already under constant strain. Physicians now find themselves confronted with the prospect of increased financial strain, particularly as it relates to their ability to plan and save for retirement. This not only undermines the well-being of healthcare professionals, it jeopardizes the stability of struggling healthcare. The CMA urges the federal government to reconsider these proposed tax adjustments and to take proactive steps to address the concerns raised by the medical community. Our health system and the people who work tirelessly to prop it up cannot withstand yet another setback.
Do the consultants that they use to come up with this stuff not realize that it's going to affect the medical system so much? I mean, I really find this kind of crazy that it's the doctors out of everybody that this is affecting and that they're pushing
out of everyone, right? After the COVID and all the fucking virtue signaling and everything else.
The colleges controlling what they do, basically, like they're not being allowed to go outside of these sort of paradigms.
So now I got a couple of clips.
Good evening, everyone. A clash between Canadian doctors and the federal government had Ottawa playing defense today after a major warning from the Canadian Medical Association. It says capital gains tax changes introduced in the 2024 federal budget will have adverse effects on physician recruitment and retention at a time when 6.5 million Canadians don't have access to a family doctor. A recent ranking put Canada last when compared to the number of adults in other developed countries who had access to a primary healthcare provider. CTV's Michael Couture leads us off with the financial plea and the response.
Family doctors is really kind of the smallest of the small businesses out there.
Dr. Ali Khan Abdullah has practiced family medicine for 30 years. He incorporated the business to help it run smoothly and to help save for his own retirement. But he says changes to the capital gains inclusion rate in last week's budget change the calculation.
Now there's even more incentive for people to say, okay, well, maybe it's time to close up the doors because the cost of running a business is more so than the benefit of being able to save for retirement.
If the budget passes, the capital gains inclusion rate would increase from half to 2/3 of personal profits over $250,000. It also applies to all gains earned by trusts and corporations, even medical practices.
Changing the taxation rate and inclusion rate inside those capital gains is akin to an 8% retrograde taxation on those investments for our retirement.
Dr. Ross points out incorporating was allowed more than a decade ago in lieu of increased fees. Some compare it to a defined pension plan that physicians set up for themselves. But the Prime Minister says it's all about fairness.
We just don't think it's right that a student or an electrician or a teacher be paying taxes on 100% of their income, while others have the opportunities to use accountants and pay taxes on only 50% of that income.
That's different though, right? It's kind of out of context, isn't it?
Well, yeah, because all those people also get a pension.
Yeah.
And, you know, employment benefits. If they get laid off, they get an EI and vacation time, arguably, sick days. I mean, if you're talking about government employees, they all get great pensions. And, you know, through 2-3 weeks of paid vacation. And that goes up to 4 weeks after 10 years, 5 weeks after 15 years, and 6 weeks after 20 years. So you can add that. And then you got the, you know, I think you get it at 55 or 60. You get it at the youngest possible age you can get it. But why not the doctors? I wonder if the nurses do. The nurses probably do, right?
Get
Everyone
what?
at the hospital.
Get
is
what?
treated like everyone working at a hospital, say, is probably being treated as an
Employee.
Yeah.
That's what they said at the beginning. And doctors
That would be the 1/3. That'd be the 1/3. So it's not like the surgeons and the nurses and that. It's the actual the doctors. Your family doctor, which 6 million Canadians can't find right now.
Yeah. Well, they're not all looking.
Well, there's not a family doctor available for 6 million people.
Yeah.
Physicians say there should be exceptions.
You must make a carve out for people in professions, in businesses that actually serve the population of Canada. You need to give them a special arrangement.
The CMA wants to meet with the government to discuss a carve-out. The association worries if there isn't one, it could affect Canada's ability to recruit and retain doctors.
It's all coming down, buddy.
Well, I was just gonna say, like, when something gets so complex, like, have you seen any of these examples of people going through the capital gains and the calculations and stuff? It's crazy complex. You wonder, like, how are these systems gonna survive? You know, I'm talking about non-eligible dividends, refundable portions back. There's a refundable tax. There's a in unrecoverable tax. There's a refundable tax. It's like 5 or 6 transactions to figure out what they need to owe. It just seems crazy. There's an effective tax rate of about 29% on capital gains. That's what it used to be. Now it's up to 39. So it went from 29%. This is after all the recoverables and non-recoverables and all that, using an example of like $50,000, it's went from 29 effective tax rate to 39%. So that's 33% more taxes overall in this sample. But I mean, the amount of calculations to get to that. And then he's like, at first glance, a few things to consider. This is from Mark McGrath on X. He says, paying salary and contributing to CPP, taking full advantage of RRSPs, TFSAs, RESPs, FHSAs, and IPPs. Like, can't get any more complicated than that. Sheltering corporate assets within permanent life insurance policies, triggering gains now and paying out the CDA. I mean, yeah, you need, I guess, accountants to figure out all this shit, eh?
Yeah. Well, let's play another clip.
It's been billed as a change to have the country's wealthiest pay more. But despite Ottawa saying more than 99% of Canadians won't be impacted by its capital gains tax increase, doctors are telling a different story.
We are being targeted with the same brush that is apparently being used for larger multinational corporations operating in Canada.
Dr. David Poon says many like him don't get pensions, insurance, or sick days, meaning they have to save up for retirement and family on their own. They often do so through a professional corporation, but that method means those who use one could face a tax increase on some of their capital gains. As of June 25th, individuals will see the inclusion rate rise from 50 to 67% on any annual gains realized above $250,000. Corporations like Poon's, though, face no threshold, meaning the inclusion rate will increase for all realized capital gains. Accountant Don Carson says that change for doctors could have a big impact.
Could mean that there's less money available for retirement for our family doctors, which just further make it less attractive to practice in Canada.
Some politicians have also been raising concerns about what the change means for doctors and Canadians.
They're going to get hurt the most. And everyone else that builds up a business, you try to sell it, they're going to get gouged as well.
Poon calls the government's move a retroactive tax on their savings and warns it could lead to more doctors doing less work.
I cannot think of a better way to disincentivize physicians to work, to decrease productivity, and to harm our already strained healthcare system than to increase taxes on doctors who worked so hard during the pandemic on their retirement funds, on their children's education, and any sort of livelihood that they were working so hard to have. Why work?
He's now trying to rally professionals like doctors against the changes, arguing they shouldn't be lumped in with the ultra wealthy.
I think I would agree with that. I mean, the doctors around here don't seem super wealthy.
Well, imagine all the costs are going up for all your running your business. They like inflation, which I want to look into it next time. And in America, I heard that they don't include gas and food in inflation, which is absolutely crazy. But
just in America,
the numbers, I don't know. I haven't checked the Canadian details, but imagine, your costs are escalating and you can't get, as if the government's levels out your bill rate or whatever, right? Since they have to pay everything, as if that goes up in step with cost, right? Must be a constant battle just to try and keep making money.